everyone can be seated. Good morning, members of the jury. Good morning. We're going to continue this morning by turning to the defense to call its next witness.
Defense calls Dr. Eldra Solomon.
Affirm the testimony you will give will be the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
Sit please right over here.
Good morning, Your Honor.
Name bar, counsel.
Good morning. Can you please introduce yourself to the jury?
My name is Eldra Solomon, and I am a clinical and forensic psychologist.
Dr. Solomon, can you explain to the jury what your education background is?
Yes. I have a PhD in clinical psychology from the University of South Florida, and I have 2 master's degrees. One is from the University of Florida, and it's in biology, and the other one is from the University of South Florida in psychology.
Talk to the jury about your work history.
Well, I taught college biology for years, and during that time I started writing college biology textbooks, and I still do that. And at some point I decided that I wanted to work on the cutting edge where biology and psychology come together. And then somewhere along the way I added the criminology. So I think that biology and psychology are both very important in understanding human behavior and in understanding how the brain works, how the mind works. And so I have a clinical practice in which I work with people who have serious mental illness and people who have experienced a tremendous amount of very serious trauma. I work with people who had horrible, unbelievable childhood trauma, and I also work with first responders like police officers who have had a lot of horrible experiences in the line of duty. So I try to always consider the biological aspects as well as the psychology of people's behavior and their minds.
How long have you treated patients as a psychologist?
I became licensed in 1990. And so it's more than 20 years, almost, I guess, 25 years.
What are the requirements in order to be a licensed psychologist?
Well, you have to have a PhD, and you have to have done an internship in which you're supervised for a year. I did that at Florida Mental Health Institute, and during that time I worked with I had several jobs during that time, but one of the rotations that I had was working with seriously mentally ill patients in an inpatient unit at Florida Mental Health Institute. They don't have that anymore, but at that time they had an inpatient unit. And I worked there with very seriously mentally ill people.
Now, the license that you hold, is that something that you have to renew in any fashion?
Yes, yes. You have to take a national exam to get licensed in the first place, and then every 2 years you have to renew your license. And in order to do that, you have to earn 40 credits of continuing education. So there are a few types that are required, like ethics and law, and every 2 years we have to study domestic violence. So there are a few required courses, but a lot of them are left up to us, and I do some of mine, at least in the forensic area, to know what's going on in law and mental health.
Explain to the jury the difference between a clinical psychologist and a forensic clinical psychologist.
Well, a forensic clinical psychologist is someone who has also, in addition, studied and taken courses in how psychology and the law work together, and helps me, for example, to understand the process of a trial and how to evaluate, do psychological evaluations of people who have been accused of various kinds of crimes.
As in doing your work as a forensic psychologist, have you had opportunities to evaluate individuals?
Yes, I have evaluated many individuals, many, over the past many years. I started doing the forensic work very early. I was still on my internship when I just kind of fell into it because I had a client with whom I had done family therapy, and her son robbed a bank with a toy gun, and he was really mentally ill, and she asked me if I would come in and speak for him, not then as an expert, but as his mental health provider. And so I did that, and then from then on I started doing, I did a lot of evaluations for the court, and that means I wasn't on the defense team or on the state team. I was doing them at the order of the judge.
In doing evaluations in the past, have those included evaluations regarding someone's mental status at the time of the offense, an insanity evaluation?
Oh yes, I have done many insanity evaluations. Well, maybe not many, several insanity evaluations.
And in the course of doing your evaluations and your expert work, have you testified before in court?
Yes, I have.
How many times have you done that?
I don't have a number or a list, but I would estimate at least 20 times. It's not something that I do like regularly. I mostly see patients in my private practice. So this is something that I do when I'm asked to do.
When you have testified as an expert, has that only been in Hillsborough County, or has that been in other counties as well?
I have testified in other counties as well.
Okay. You talked about a little bit earlier about working on textbooks, biology textbooks. Are there other publications that you've had during the course of your career?
Yes, I have published many articles in refereed journals in the field, and just recently, I think it was in 2012 or 2013, I wrote a chapter that's in a series of 4 volumes on criminological psychology. and that chapter talks about the biology of trauma and how that can affect people throughout their lives, both psychologically and also how it can affect their bodies, because a lot of illness can be traced back to traumatic experiences.
Did you at some point get involved with working on the case involving Julie Schenecker?
Yes, I did.
I'm sorry, before I go into that, at this point, I would tender Dr. Solomon for voir dire.
No objection.
You may continue.
When did you become involved in this case?
I received a call from the public defender's office. I believe she was arrested on Friday. Was it January 27th, 6th? 27th.
Did you become involved shortly after arrest?
The day that she was arrested, I received a call about evaluating her immediately, and I was supposed to go see her that day, but she was then taken from the jail to Tampa General Hospital because she had overdosed and she was very ill and needed to be detoxed. And so I then went to see her with an attorney from the public defender's office and with the mitigation specialist, Carolyn Folgero, on Saturday night, after the shootings were Thursday night, and this was Saturday night, so 2 days later. And we would have gone earlier, but it was Gasparilla Day, and we couldn't get to Tampa General Hospital. So we were there that evening.
When you became involved in the case and you saw Ms. Schenecker, eventually were you provided with documents for this case?
Yes, ma'am, I was.
And what kind of documents did you receive throughout the course of working on this case?
A lot of documents. I received all kinds of medical records, like hundreds and hundreds of pages of medical records from many different hospitals and clinics, and I received
Did you receive police reports?
I received police reports. I received the copy of the confession. I received pictures of the house. I received many transcripts of depositions, and I received correspondence and emails between family members, Ms. Schenecker and other family members. I received a letter she wrote to her daughter about her illness. There's a list of at least over 50 documents that I reviewed.
And during the course of conducting your evaluation, did you visit Ms. Schenecker other than the time that you're talking about at Tampa General Hospital?
Yes. I visited her a total of 9 times in the jail. Well, no. The first time was at Tampa General Hospital, and then I visited her 8 times to conduct a psychological evaluation, to do clinical interviews of her. And do you want those dates? I first saw her at the jail on February 9th, which was just a little more than a week after she left the hospital.
When you went and saw Ms. Schenecker at the hospital, I believe you were saying that she was there because of an overdose.
Yeah.
Were you provided with the medical record from Tampa General Hospital.
Yes, I was.
And what was her status at that time when you first visited her?
Well, she was diagnosed with lithium toxicity because she had overdosed on her lithium, which is a psychotropic medication for bipolar disorder. It's a mood stabilizer. And she had also overdosed on Coumadin, which was a prescribed medication, and then a variety of other pills in an attempt to suicide. So she was in the process of detox at Tampa General Hospital. She was extremely shaky and confused, and she came actually in and out of confusion. So that part of the time she was able to explain something, talk about her history a little bit, and part of the time she was kind of like in and out of her confusion. And later, when I talked with her at another time, she didn't remember anything about our being there. She remembered some people had come and she thought she might have remembered my being there, but she really didn't remember any content of what she said or what happened during that visit.
When you would visit Ms. Schenecker and conduct your evaluations, were there times that you also did testing?
Yes, I did psychological testing in order to get more data on her state of mind, and I use testing, as other mental health professionals do, to confirm some of my clinical impressions.
Now, is testing something that can be used standalone?
No.
How do you incorporate testing in evaluating a person?
Okay. Testing helps me to form an opinion of her state of mind and how she functions. So does talking to other people. So what I always try to get confirming information from other people, other family members, sometimes friends, other people in the person's life. And you put the pieces of the puzzle together slowly over time. So it's my interactions with her plus jail records plus medical records plus testing. All those are pieces of the puzzle that I have to, and any expert has to fit together to understand a person, because people are very complicated and how they function and how they think is very complicated.
Without getting into the results of the testing, what were the actual tests that you conducted with Ms. Schenecker?
Okay, the main test I gave was the PAI, which is the Personality Assessment Inventory. And that test, interestingly enough, was used by at least two of the other experts in this case. And I did the first one, and then people did them later. And it was interesting, and maybe I can say something later about how they were consistent.
Were there other tests that you did other than the PAI test?
I also did the Trauma Symptom Inventory, which is called the TSI, which also measures some things like anxiety and depression and things about how people feel about themselves, how they respond to stress, what their behaviors might be, and what they might experience when they're under a lot of stress. I also did a couple of sentence completion tests, and I always do mental status tests. I do that at every time I meet with anyone. I think I also did a dissociative experience scale test, because on one of the other tests she showed to be very dissociative. That is that she lives in a fog a lot. She's in and out of kind of a foggy state of mind.
So the second test that you did was a follow-up to the result of a first test?
Yes, yes.
Okay. Now, when you're doing these kinds of tests, are they tests that as someone goes on in their progression or their circumstance change, the results of the test could potentially change?
Yes, that's always possible that that would happen. The PAI is fairly stable over time. Now, some things could change because people's life circumstances change. Someone who has just undergone a terrible trauma might answer questions about anxiety and depression in a different way. But there is some consistency about how people respond to a lot of the questions on these tests.
During the times that you were visiting Ms. Schenecker, where was she located other than the time at Tampa General Hospital?
When I visited her the first time in the jail, which would have been my second contact with her, she was on suicide watch in the infirmary of Falkenberg Jail. And at that time, she was wearing a suicide gown. She wasn't allowed to have regular clothes, and she wasn't allowed to have a regular bed or cot, she just had a bare cot. She couldn't have sheets or blankets or anything like that. She wasn't allowed to even have her glasses. And in fact, the first 3 times that I saw her there, she wasn't allowed to wear have her glasses, so it was difficult to have her do any testing. We tried, but it was very difficult. So I'm not sure, did I answer your question?
Yes. During that time frame that she was in the infirmary on suicide watch, did you wait until she was able to get her glasses in order to have her complete some of the tests?
Yes, we completed the test. Actually, it was on our 4th interview. So it would have been the 3rd time I saw her in the jail. And the other times, we did try to do some testing, and I tried to help her read some of the questions, because I thought it would be good to have the evaluation, the written evaluation in terms of testing as soon as possible after the shootings, so we could understand her state of mind. So we did start the testing from the beginning, but it was difficult. And the first time I saw her, she was still in shock, and it was, it was really hard to have a regular conversation. She was in that infirmary for many of my interviews with her. I would have to check, but I think about 6 or 7 of my interviews were there.
When you obtained the information on the case, did that include a complete history of Ms. Schenecker's mental health records?
Yes. Yes, I read hundreds of pages of mental health records.
What were you able to discern from the records regarding what Ms. Schenecker's diagnosis was reflected in the records?
From the records and from my clinical evaluation. Is that what you're asking?
What I'm asking is, initially, when you review the records, what is documented as her diagnosis from the records?
Okay. She has been diagnosed many times as bipolar disorder type 1 with psychotic symptoms.
What does that mean?
Okay. Well, there are 2 kinds of bipolar disorder. Let me start by saying that bipolar disorder is one of the most serious psychological disorders. And when you add to that psychotic features, it is a really, really terrible, terrible disorder.
Does everyone that has bipolar 1 diagnosis also have psychotic features?
No, no.
Explain to the jury how bipolar 1 disorder with psychotic features, what that means.
Okay, well, first of all, bipolar disorder by its very name tells you that we're looking at two poles. We're looking at the up or the manic aspect and the down, the lows or the depressed aspect. So someone with bipolar disorder has a lot of highs and a lot of lows. So very manic, which means high energy, doesn't sleep, doesn't think very well, makes terrible decisions, very impulsive. Those are some of the characteristics of being manic, okay? Some people use the word loosely, like, saying, well, he's being manic, but when you talk about it in terms of this disorder, it's a very serious kind of behavior. And then I think everybody knows what deep depression is like. It's like when you can't get out of bed or you can hardly function and your mind feels like it's weighted down and you lose your interest in normal activities and you don't feel like engaging with other people. You just want to crawl in bed and pull the covers over your head. That's deep depression. And in bipolar disorder, and particularly in the bipolar disorder with psychotic features that Ms. Schenecker was diagnosed with, there were very high highs and extremely low depression, very low lows, severe depression.
What does it mean to have psychotic features?
Okay. The word psychotic is used commonly, and I think it's misused and misunderstood a lot. I think that most people would say psychotic means that you behave in a bizarre way or maybe you're crazy, right? I think that's what people think of as psychotic. But actually, and some people who are psychotic have hallucinations, for example, where they think that maybe the FBI is talking to them through the TV set. That would be an auditory hallucinations, hearing someone talk to you who's not really talking to you. Or if a hallucination example might be if you thought that there was a Martian talking to you or the devil's talking to you and telling you to do something awful.
Do you have to have auditory hallucinations in order to be psychotic?
No.
Or have psychotic features?
And you don't have to have visual hallucinations either. Visual hallucinations are where you see things that other people don't see. So you might see a huge rabbit, an imaginary rabbit, but you don't know it's imaginary, that's in your life walking around with you. That would be an example. So you don't have to have hallucinations or delusions. Let me talk about delusions for a moment, because that's what we think about when we think about psychosis or schizophrenia or psychotic people. We think about that they have hallucinations and delusions, but they don't have to. Delusions are where a person has a set of beliefs that don't make sense to anybody else, but they really believe them, and they're in their minds, and it's a psychotic kind of thinking. So, as for an example, I'll use an example with Ms. Schenecker. Is that okay?
Yes, that's fine.
That she believed that her son was in danger of being sexually abused, and she really believed that. She believed that her daughter was getting bipolar disorder like her. There was no evidence to support that belief, but she really believed those things. Those are delusions. Those are a sense or one aspect of psychotic thinking. But there are other aspects of psychotic thinking
And
that,
we'll go to that.
Oh,
Can
okay.
you explain how someone becomes bipolar?
okay. We know that there is a genetic component. We don't know if you can become bipolar without that. We don't know that. But in a lot of people who have bipolar disorder, there is a genetic component. And in Ms. Schenecker's case, there is a family history of what might be bipolar disorder. It was in some relatives in the past, and the records aren't good. Bipolar disorder used to be called manic depression, so I just want to say that in case you're familiar with that term.
So there's a genetic component.
There's a genetic component, and then not everybody who has a family history of bipolar gets the disorder. So nobody really knows for sure why some people get it and some people don't get it. We know that it's a brain disorder. We know that it has to do with the biochemistry of the brain being imbalanced. We don't know exactly how that happens, what precipitates that.
When people are diagnosed with bipolar 1 with psychotic features, is that a patient that you're familiar with? Have you
Yes.
treated people before with bipolar 1?
I have treated people, several people with bipolar 1 disorder. I've treated a lot of psychotic people.
As far as alcohol use or drug use of people with bipolar disorder, is that a problem at times for people that are diagnosed with bipolar 1?
A lot of people who have bipolar disorder are in a lot of emotional pain, and they drink alcohol or take pills that help them feel better. They self-medicate. That's very common.
When you say emotional pain, is there physical pain as well associated with depression or with bipolar 1?
Yes, people report to me that when they're very severely depressed, that they often feel it in their body and their bodies feel bad. And there are a variety of symptoms that people might feel in their body. And a lot of people who have severe depression or bipolar disorder will be very high on the somatic scales in psychological tests, and a lot of psychological tests have those scales, and it means that they feel so badly in their minds that sometimes they convert some of those symptoms into body symptoms. And let me just give you a common example. We all know people who get migraine headaches when they're stressed. And we all know people who have GI tract, digestive tract problems when they're under severe stress. So those would be examples of how the body and mind work so closely together, and the mind can cause problems in the body, just like the body's off-kilter biochemistry causes problems in the mind.
When you reviewed Ms. Schenecker's mental health records, the diagnosis being bipolar 1 with psychotic features, did you come up with your own assessment of Ms. Schenecker based on your evaluations and your review of all the information?
Yes.
And what is your diagnosis for Ms. Schenecker?
Okay. In my opinion, Ms. Schenecker does have bipolar 1 disorder with psychotic features.
Based on your review of the records and your evaluations of Ms. Schenecker, what led you to the conclusion that she not only has bipolar 1 disorder, but also the psychotic features as well?
Okay, that, my opinion on that is based on my own experience of spending more than 20 hours with her, or about 20 hours, and on the medical records And do you want me to, may I just go through some of the things that led to my opinion from the medical records?
Yes, were there prior examples of psychotic thinking that you observed from the records and from your observations?
Yes.
Okay.
Prior meaning,
Meaning in the medical records before you had any contact
right,
with her?
and then, yes.
While you
but
had
both,
contact with her?
Both.
Yes. Talk to the jury about the times that you either observed or reviewed Ms. Schenecker having psychotic thinking.
Okay. I can do that. There are thousands of pages of records in this case. Okay, Ms. Schenecker's history of severe mental illness began in adolescence and has been documented for a lot of years. The bipolar disorder, that diagnosis, was diagnosed many times by many psychiatrists and psychologists in many different hospitals and clinics, including military hospitals in Europe, in Germany, and including the national, Walter Reed Hospital is what we know it as.
Now, what is Walter Reed Hospital?
It's the National Military Medical Center in Bethesda, Maryland.
When was Ms. Schenecker in that hospital?
Okay, she was in that hospital in 2006. Well, let me backtrack. Would that be okay if
Sure.
I backtrack? Okay, she was in the hospital through a study by the National Institute of Mental Health. She was in the hospital then for a period of 9 months. She was part of a study, but
Objection. May we approach?
Yes. I'll remind you of those important instructions not to discuss this case among yourselves, not to discuss it with anyone else, not to allow anyone to discuss it when you are in your presence, not to speak at all with attorneys, witnesses, defendant about any subject your deliberation is finished, not to notice any reports about the case from any source whatsoever, not to do any sort of research, gather information, or communicate about the case or the people or places involved through any means, including electronic devices. We'll send you out for about 10 minutes.
All right.
Jury's exit the courtroom. This is going to be a 10-minute break.
Okay.